put some of that on there. And okay. Stan, you've been sitting much too long, much too long. Welcome, 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 welcome to Truth, a radio program designed with you in mind, a program whose sole purpose is to empower you, our listeners, for information leads to knowledge, and knowledge is power. And as always, I want to empower you to take control of your life, those things that impact you, your family, and your community. As always, too, we want you to go to the website at www.gwen-truth.com so you can access all those all important links that will link you to what? All those powerful links of information. So go to www.gwen-truth.com so you can make that important linkage to that all important information. Also, to all of those who have not yet signed up for affordable health care, please, please, please do so by the 31st. Even though they're talking about the ability to wait and sign up for April, if you can do it now, do it before the 31st, okay? That's Affordable Health Care, the Patient Protection Affordable Health Care, and Affordable Care Act. And we also want you to make sure that not only do you do it in time, but understand that a lot of what's going on in terms of the misinformation that's going on college campuses and the like, young people, other individuals who qualify for this, disregard that and make sure that you sign up so you can get the affordable care that you deserve, okay? It's quality care, it's affordable care. So make sure that you sign up by the 31st of this month. I want to say to all of our listeners too, we know Easter is coming up. There's a reason for that season, and we're going to have a show in the near future to talk to you about what that's all about. My guest tonight is an individual who started to get in when we did our previous show. We started to get into this medical marijuana and medications, and you know, what's all that about? What does it really do? And I've got her back to talk about that and other issues related to our returning veterans. And we're going to talk about some other services that are available for men and women in our community as well. As has been stated, I'm Gwen Azama-Edwards, former city commissioner, retired city clerk, city of Daytona Beach. And we're so happy to have all of you here with us tonight. My guest is Dr. Vanessa Harvey-Lents. And we're going to talk about the wonderful world of pharmaceuticals and medication, Vanessa. Welcome, welcome, welcome. Since this is a different show and it's going to be on a separate video, would you share with our listeners a little bit about your background so they know that not only do you know what you're talking about, but you got the background, experience, etc., to justify your expertise?
Yes, thanks again for having me on again, Gwen. I have completed my doctor's degree in addiction disorders from Brennan Institute College. And what that is, I focus on addiction behaviors and all addiction behaviors, gambling, substance abuse, eating disorders. I have a certified addiction professional, which is governed by the Florida Certification Board in Tallahassee. I'm a certified prevention professional, which I deal with adolescents in school systems with preventative behaviors like dropout prevention, pregnancy prevention, suicide prevention. I also am an internationally certified alcohol and drug counselor, which allows me to practice in any state in the continental USA and 20 foreign countries outside the USA. I have a master's degree in counseling, marriage, and family therapy from Webster University. And I have a bachelor's degree from my alma mater, go and water your tigers, in mass communications, journalism. So I've been in business most of my career. I owned a business in Daytona called Substance Abuse and Family Enhancement, which is SAFE, and it specialized in addiction. I started a practice in DeLand called SAFE Health Services, and we deal with mental health, psychiatry, and medication management. I'm currently in private practice in Port Orange with Northeast Florida Psychiatric Association with Dr. Gary W. Frick, and we deal with addiction and psychiatry. So I think I'm qualified to talk about marijuana if not anything else.
And I think I mentioned on the prior show too that when I started going to college, my goal at the time was either to be a psychologist or a psychiatrist. And but when I looked at all that they had to go through, I mean, you practically have to do a lot of what a medical doctor does. Absolutely. And learn a lot of what they learn in terms of the body and you know, the pharmaceuticals or drugs and their interaction within the body. And that didn't stop me though. What really stopped me was that you had to take you had to be analyzed yourself, right?
Right.
You got to go through that whole process. I wasn't sure that I would be able to pass, to tell you the truth. So I settled for something a little bit close to it, but not quite, of course. And that was the studying psychology, and then, you know, getting into guidance and counseling. I mean, a great field, and my hat's off to you to be a doctor, you know, in terms of that profession. But we started talking about marijuana and the legalization of it in terms of for medical purposes for the ballot issue that will be coming forth this fall. And you had certain ideas about, not just ideas, but based on, I guess, studies and actual fact, what actually is happening and happens in terms of marijuana in the body for people that are on that. And then also there is, I guess, medication that actually utilizes it as well. Could you get into some of that for us?
Yes. The Food and Drug Administration in 1985 approved Marinol, which is a synthetic form of marijuana, and it stays in the body 3 to 4 hours. Opposed to smoking marijuana, it only lasts 30 minutes. And smoking marijuana, you have to also take in consideration that it has over 400 negative chemicals in it, just like nicotine. And so when you have like HIV, AIDS, cancer, and any other disorder that or medical diagnosis that causes you to have nausea and vomiting, and that's what medical marijuana does. It helps you eat so you can keep your weight up and you can rest, and that's what it's used for. It's not used for pleasure. It's used for those purposes only. And so when you already have those diagnoses and you smoking marijuana and it's not Marinol, which is prescribed by doctors, then you're subject to exacerbate your current diagnosis, because now you're putting 400 more chemicals in your body. And if you have cancer, then if you smoke marijuana and those 400 chemicals may cause cancer, now you have really undone all the work that chemotherapy has done. So, and then plus when you do chemotherapy, your immune system is low. So it's not a good thing. You should not make it legal, to smoke marijuana, because even though it gets in the bloodstream quicker, it doesn't last as long as Marinol. And when they approved it in 1985, it was proven that it benefited the patients better than it did the smoking the marijuana, because you don't know who's cultivating that marijuana. Even if they have marijuana houses like they do in California, shops and everything like that, you still have to smoke that marijuana, and then you have to deal with all those other chemicals in that marijuana. And you have to realize too, those marijuana cigarettes don't have a filter. That's another thing that you have to deal with. Even though cigarettes have a filter, you still get cancer. So it's not a good thing. And for it to be on the ballot, I will employ the community to say no to this, because it's not going to benefit. It causes other biological problems as well as reproductive things for men and women. And I am going to be teaching a course, a 3-hour course at Daytona State on marijuana effects on the male reproduction system. So I hope everybody, contact and come to my class. So
now, what are some of those effects then on the reproductive system?
Low sperm count, and then if they do conceive, the mother conceive, that baby oftentimes when they get school age have some form of ADHD. So, or low cognitive development. So it's not a good thing at all. Okay? So the actual cannabis plant has many other chemicals, like I said, over 400. The plant is not stable, so it can't mixture or metabolize as well as the marinol that's extracted from as THC to give to patients. So I can remember working for Stuart Marchman Center, and we had a couple of HIV and AIDS patients who were on THC, which was marinol, and for nausea, and it was very effective for them. You know, and they were, ironically, when you talk about people with HIV and AIDS, sometimes they get that disease by being under the influence of other drugs. And so they were at Stuart Marchman Center because they were addicted to other drugs and contracted HIV or AIDS. So you have addiction issues with HIV and AIDS, and now you're giving them, even though it's marijuana or cannabinoids through THC, marinol, it helps them keep their weight up and cuts down the nausea, so they can keep their T cells up and things like that.
I went to a forum where John Morgan and Morgan spoke, and he was talking about the fact that individuals who, because his brother works at his company and he does some really positive things, and the only way he can actually do a lot of what he does, he says, is because he's able to, what do you call it when you smoke it, to smoke the marijuana. And he's saying that I guess it dealt with a lot of the nausea that he had and the like. He mentioned the medication, which you just mentioned, the marinol, and he was saying that there were some negatives that were involved in that. It looks like from all of the surveys that they're taking that the ballot issue will pass. There was some concern on the parts of some of the individuals who heard the talk from Tiger Bay, who were concerned about young people and the impact of their getting their hand on what their parents had, even if they had it for medical purposes. Because the biggest problem we have now in terms of drugs are prescription drugs.
Absolutely.
Where the kids are getting their parents' prescription, and whatever else it is that their parents have, they're getting it, having access to it, and they're going out and either using it or also giving it to friends or selling it. So that is a real problem now, isn't it?
That's absolutely going to be a problem. We can't even get parents to be responsible for securing weapons in the home. Keeping their kids from drowning, keeping their medications out of reach of their adolescents who OD on their medication at farm parties. And farm parties are pharmaceutical parties where they bring all the medication from their parents' household, put it in a big bowl, and they spin the bowl, and they just take it with alcohol, and they die. And so if we can't manage that, how are we going to keep control of marijuana out of their hands? And like you said, they're going to sell it. They get their parents Xanax and Loratab, and they sell it on the streets. So this is just one more problem that we're going to have. And unfortunately, that his brother is smoking marijuana. It doesn't make sense to me that you would smoke marijuana and it lasts in your system for 30 minutes, opposed to 3 or 4 hours of relief from the nausea. So it just doesn't add up to me. And if it does pass, we do have to deal with adolescents in this drug. They already smoke it illegally. Now you're going to have it in the home legally. And are you going to now pass a law to press charges against that parent who allows their child to go in, or not allow, but they get hold of this marijuana and they get caught with it and they get arrested? Where did you get it? Oh, this is my mom's stash. Because she has whatever diagnosis. So are you going to press charges against the parents? Are you going to hold them accountable for that? So that's a whole nother can of worms that he might have to represent, Mr. Morgan and Morgan, those parents for that.
I know one of the things he kept stressing is responsibility, that people are going to have to be responsible when it comes to having to deal with this type of situation if the amendment or once it passes. Now, we were talking too about veterans returning
Right.
to this country and the types of issues and problems that they're having. And many of them, I remember reading years back that many of them, what was happening was that they were being put on drugs, and sometimes it helped, sometimes it didn't, but they found themselves on multiple drugs such that they couldn't even function. And as a result, we had individuals who had served this country well, who are now back in the country, and we really weren't doing things for them that allowed them to continue to be functioning adults.
What happens to so many vets, they go and they serve this country. They go and they fight it and serve their country admirably, and then they come back with psychotropic diagnosis of PTSD, bipolar, some kind of mood disorder, anxiety. Then they get put on medication. A lot of them don't trust the government once they come back, so they don't seek their VA services. And my whole focus is educating the family members how to get the services your veteran needs and deserves, and encourage them to go get those services and those benefits that they deserve and need to help them, process what's happened to them and acclimate back into society. And so the first thing I encourage the family to do is when they come home, try to find out what their DD 214 says. That's very important. And that's a document that the Veterans Administration used to apply benefits, as well as they can get other benefits from the government if they're honorably discharged. That's the first thing you have to see, if they're honorably discharged, and that's at the bottom of the form. And once you know they're honorable discharged, then you can advocate for your family member. And there's some things that you can do to help them get back into society and get back on their feet. The one thing you have to understand is that when a person is in the military, they're on a routine. They're on a very strenuous and active routine. So when they come home and they become sedentary and they sitting around, that's the wrong thing you want them to do, because they get depressed and then they isolate. You want them to continue to be active. You want to find out what their diagnosis is on that DD 214, what their education was, what type of service they served. So you can really get in and find out how you can really help them. One of the things you have to do is say, okay, if they have a diagnosis, you need to immediately get to the VA. If they don't want to go to the VA, they still have medical insurance, TRICARE medical insurance. They can get a private provider that accepts TRICARE. So they don't have to go to the VA if they don't want to. But if they're disabled, got an amputee or something like that, then they want to get that disability benefit. They want to apply for that benefit of a percentage of disability, so it can have income immediately coming in. If they don't have a disability and they was honorable, and I still say they still need to go to therapy, because they really don't get any kind of therapy once they're discharged, especially if they're coming from combat. They get a what they call it decompressed, but they don't get therapy. And so I would suggest that they get some therapy. Convince them to get therapy once they get home. Once you find out they may or may not have a diagnosis of PTSD or mood disorder, and if they don't have that, that's a win-win. If they do have that, you want to encourage them to get to see a psychiatrist, whether it's privately or with the VA. And once they get that psychiatrist, you want to know what kind of medication they're on. You want to understand what the medication, you want to do your research. Do not allow your family members to be on all this medication. You don't know what it is and the side effects and how they respond to the medication. So you want to be involved in the medication process. That's very important. And then once you find out what medication they're on and the dosage, you want to make sure that you go to the appointments and that you're involved with whatever treatment after that. I know the VA have licensed clinical social workers there, but they do mostly case management services, linkage to home care and nursing care, medication management, stuff like that. But they really don't do therapy, one-on-one therapy with that vet. So you want to try to get them to a licensed therapist that focus on their particular diagnosis and help them with those issues. PTSD, trauma, and there's some things. It's 6 types of trauma that veterans have. Acute stress reaction, combat operational stress reaction, acute stress disorder, post-traumatic stress disorder, mood disorders, and paranoid personality disorders. These disorders are specifically to whatever trauma they endured while they was in the military, whether it was in combat or if they was assaulted by one of their own. So these are some issues and diagnoses you want to look for, and maybe it might not be on the DD-214, but they might verbally tell you. And so you want to address that issue. And you want to definitely look at those and see if they really meet those criteria, or talk to their doctor and say, I've noticed these behaviors in my vet, and I don't know what's going on, but these are some of the behaviors. Start documenting the behaviors, their routine, the things they say, the frequent waking at night, the mood swings. All those things are very important for you to report to their doctor. Some of the other things that you can do, even if they have a dishonorable discharge on their DD-214, there's still hope. Even though that honorable discharge is like a felony, it's like a felony to them. And the world sees it as a felony, but they still have hope. If they have any kind of employable skills, you need to hone in on that, because whatever happened for them to get dishonorable discharge, there still is hope. Like, for instance, it's equivalent to being incarcerated and getting out of prison. I will share this with you. My brother, he just was released out of prison after 31 and a half years. And now he's pursuing a job as a truck driver. So there is hope. You can still do something as a dishonorable discharge veteran. Don't think that you have to live on the street, be homeless. There is hope. There's things that you can do. You can become self-employed as a truck driver.